It's Thursday, August 21st, 2025. Welcome to Make It Make Sense. I'm Granthermes. Today on the show, the Department of Justice goes after kids, specifically trans kids and their families. Some newly released subpoenas show the Attorney General Pam Bondi has been trying to get the private information of 24 trans kids in Pennsylvania in hopes of punishing hospitals who do basic gender-affirming care. So I thought this would be a good chance to talk about what those subpoenas are actually asking for, how it fits into the larger government attack on trans kids right now, and why it matters even if you're not trans or don't think that you know a trans person. But first, make sure that you're following or subscribe to the show, whatever podcast app you listen to it on. Like, subscribe, and hit the bell for notifications on YouTube. Sign up for the Make It Make Sense Substack, where I've got a brand new article up right now all about how DHS has been posting white supremacist and, in some cases, outright Nazi dog whistles and signals in their posts on social media. That's also been newly updated with a statement from the official DHS spokesperson, Tricia McLaughlin, who you'll get to read, calls me deranged, tells me to seek help, and then offers to buy me some textbooks, but you can't get access to that unless you pay $5 a month for the Substack. You'll get access to that and all sorts of great other bonus content there. And as always, share the show on social media. It's MIMS Newspod. That's MIMS Newspod, all one word on every platform. I am at Granthermes on Twitter and Bluesky, and at Granthermes TV on everything else. All right, let's get to the show. Today's episode is brought to you by Cozy Earth. You know, as we head into this last month of the summer, the school year is on the way, or it started for many of us already, and that means a return to stressful schedules and hectic lives, or honestly, just the news with the way that it's been. If you're like me, you're looking for a way to just unwind. With Cozy Earth, you can transform your space, whatever it is, into an elevated haven where serenity and renewal intertwine effortlessly. I really like their bamboo sheets. They keep me cool, especially in these dog days of summer. And I really like their luxe robe. I'm a robe guy. I know, say what you will, but these are about as good as it gets. I'll even avoid planning things on the weekend just to spend a little bit more time in this robe. Now, Cozy Earth's products are a favorite among many celebrities. Kris Jenner praises their bamboo sheets as her nightly essential, raving about their softness and cooling comfort. And for 7 consecutive years, Oprah has included Cozy Earth on her favorite things list with free shipping on orders over $50, a 100-night sleep trial, and a 10-year warranty. Cozy Earth will bring lasting luxury and comfort into your home. Visit CozyEarth.com and use the exclusive 40% off code for Make It Make Sense, MIMS25. That's MIMS25. It's good for any purchase, and it's the best deal, and it cannot be found anywhere else but here on Make It Make Sense. Now, Make It Make Sense does get a cut of that sale, but, you know, it keeps the show going. It puts you in some new sheets or towels, and it keeps me in my favorite robe. Again, visit CozyEarth.com and use the code MIMS25 for 40% off. Wrap the ones you love in luxury with Cozy Earth. Okay, let's get back to the show. On Wednesday, we got our first look at 24 subpoenas the Department of Justice sent to the Children's Hospital of Philadelphia back in June. The subpoenas are asking doctors to give up personal information about their patients, again, children, including social security numbers, addresses, and any and all recorded information about the treatments of these patients. Now, the hospitals and these doctors are being asked to violate the privacy of their patients who did not consent to this. And before we go any further, I need to say here that this isn't going to be a debate about whether trans people exist. They do, and always have. They have since humans started recording things on cave walls and clay tablets. I'm going to talk about the specifics here about what we know about trans people and trans youth populations in the U.S. a little later, including the accusations of sexual assault, but I'm just not going to deny or even debate that they exist. Now, in the eyes of the Department of Justice, though, trans people don't exist. In fact, the reasoning behind believing that they can force hospitals to violate privacy rights of children is because they don't think trans people are real and therefore don't have those rights. And they think what these doctors are doing is committing crimes against kids. Case in point, a statement that Pam Bondi sent out earlier this year about these subpoenas when they went out said medical professionals and organizations that mutilated children in the service of a warped ideology will be held accountable by this Department of Justice. We'll talk about all that a little later here. The subpoenas, though, are entirely unprecedented because what these doctors are doing is fully above board, medically approved care. It'd be like forcing your doctor under threat of jail to disclose to the government the last time you got a flu shot. Now, most of what's in the subpoenas is how the DOJ wants this information sent to them, but specifically, they're singling out information that is beyond the basics. They're asking for things like prescription information, specifically for things like puberty blockers or hormone treatments. They're asking for specifics in treatment. They're asking for drawings or illustrations for things like how a procedure might work or how a doctor might explain to a child what's happening with their body. They want parental information and when parents gave consent. It's all information that you would need to build a paper trail, essentially, that would let you criminally charge doctors, hospitals, pharmaceutical companies, potentially in some cases, and parents for providing care to their child. And this is just the latest in a long line of attacks on trans people in the U.S. since Trump took office this time around. There have been at least 6 executive orders issued in the first 2 weeks of Trump's term targeting LGBTQ care, specifically trans people and specifically trans kids. The most important one is titled Protecting Children from Chemical and Surgical Mutilation. It ordered federal agencies like Health and Human Services, the Department of Defense, and Office of Management and Budget to begin erasing trans people from their documents and removing access to care. HHS was told to start removing best practice guidelines that follow recommendations of the World Professional Association for Transgender Health, the Global Authority on Gender-Affirming Care. It ordered the removal of gender-affirming care from the Diagnostic and Statistical Manual of Mental Disorders, the industry standard text for treating all sorts of mental illnesses, including gender identity disorder, which many people prior to some kind of transitioning suffer from if they are trans. And right now, the DSM says that giving trans people gender-affirming care that they need is good for their mental health. Shocker, I know. The Centers for Medicaid and Medicare Services have been ordered to stop covering gender-affirming care for kids, bringing back an exclusion on trans care that we haven't seen since 2014, and could result in 185,000 trans people losing their primary insurance provider. The Department of Defense was ordered to end the coverage of child gender-affirming care under its military coverage known as TRICARE, which covers nearly 2 million kids in the U.S. The Office of Management and Budget was ordered to withhold grant money to schools, hospitals, and research centers working on better care for trans kids. And it's here that I think I should explain a little bit about how many trans kids there are in the U.S. and what gender-affirming care actually is. According to the UCLA School of Law's Williams Institute, there are 2.1 million trans adults in the U.S., about 6 1,000ths of the overall U.S. population. The number of trans kids is harder to know. A lot of that has to do with privacy reasons, but one estimate puts the low end around 121,000 kids ages 6 to 17. But another from the Williams Institute, which only looked at kids 13 to 17, said it's actually closer to 724,000, the largest number of them living in the southern United States. As percentages of the overall population in the country, that is 35 ten-thousandths of a percent to 21 ten-thousandths of a percent. It is an incredibly small number of people in the U.S. who are getting a staggeringly large amount of attention from the U.S. government. And when it comes to gender-affirming care, it can mean a lot of things. According to the Kaiser Family Foundation, a highly respected medical nonprofit, gender-affirming care is a spectrum of medical, surgical, mental health, and non-medical services for transgender and non-binary people. It can include a lot of things, from totally reversible, like changing your hair, your clothes, your name, or taking puberty-blocking medication, to partially reversible things like hormone treatments or some kinds of surgeries, to the irreversible things like genital reassignment surgeries, which is what most people jump to when they think of trans healthcare. And those things are almost always done when that person is an adult, outside of extreme cases, according to the government's own description of how these things happen. But gender-affirming care isn't just for trans people. Breast reconstruction surgery for things like teenage cancer for cisgender women. Cis is people whose gender identity aligns with their sex that they were assigned at birth. It can also be things like specialized prosthetics for boys who lose testicles, say in a viral skateboarding accident, or even wigs for kids who lose their hair during chemo. It could also be puberty blockers for kids diagnosed with precocious puberty, which is when your body starts releasing hormones too early, usually around 8 or 9. Not treating precocious puberty can make it more likely to harm a child's development, leading to later in life behavioral problems, and even has links to substance abuse issues. But under orders like the one from the White House, those kids wouldn't get the care they need either. And on top of that, if the DOJ starts collecting the data about this stuff, hospitals and parents even will be less inclined to give that care or sign off on it. We've already seen that. Hospitals have closed or pulled back on their trans care and gender-affirming care for children, and sometimes similar care for all patients because they're worried about being targeted by the Trump administration. Even in California, which has long been considered a safe haven for trans youth, the New York Times reported in July that the Children's Hospital of Los Angeles closed its Center for Trans Youth Health and Development out of fear. It was one of the nation's largest and oldest trans care facilities, and it's been forcing families in some cases to seek care in other places, some saying that they were looking in other countries like Mexico or Ireland. But it's not just LA. Hospitals in San Francisco, Chicago, Pittsburgh, New Haven, even the National Children's Hospital in DC stop certain kinds of gender-affirming care for kids, again, out of fear the government could reduce coverage, Medicare funding, or even bring actual criminal charges, which is what it seems like they're trying to do in Philadelphia. And that's also spilling out into other parts of the medical industry. The Kaiser Family Foundation found that 1 in 7 trans adults say that they've been denied gender-affirming care by their insurance companies in a system where 1 in 3 trans people say they've had to teach their own doctors about trans people or trans care, and nearly half of their healthcare providers do little or nothing at all about how to treat them, which is a wild statement to hear from people who just want to be seen by their doctors. We also know that not having access to gender-affirming care is really bad for trans kids. The Trevor Project, an LGBTQ nonprofit, found that 70% of trans youth experienced symptoms of anxiety, and around 60% said they experienced symptoms of depression in 2024. Those numbers are 20% higher than cisgender kids. Trans youth are also more likely to think about or attempt suicide. Around half of trans kids considered suicide, compared to around 30% of cis youth. And between 14 and 18% of trans kids attempted suicide in 2024, more than double the rate of cisgender kids. And we also know that the access to gender-affirming care reduces risk of suicide. An NIH study from 2021 found that when trans kids got the care they needed, their odds for symptoms of depression went down by 60%, and their odds for attempting suicide went down by 73%. I don't know about you, but I think it's pretty hard to argue in favor of taking away access to care if it's going to have a 3 in 4 chance of making sure a kid doesn't try to wind up dead. Now, there are a lot of people who will point to things like trans regret, especially after gender reassignment surgery, as reasons to police and criminalize gender-affirming care. But a landmark study from a few years ago looked across dozens of findings from other studies. It's what's called a meta-study, and found that even after 11 years of fully surgically transitioning, 99% of trans people were happy with their decision. Just 1% said they had regrets. And when you broke that down to the kinds of surgery those people had, less than 1% of the 1% said they were unhappy with having their surgeries done at all. There are also people who say that kids can't know they're transgender because they're kids. But the Kaiser Family Foundation found that 2/3 of trans adults said they knew before they were 18 that they were trans, and 32% of adults said that they knew before the age of 10. And again, when you put that up against that regret number I just talked about, that's a pretty good reason to believe kids when they come forward and say they're trans. Then there are the people who say that allowing gender-affirming care will lead to assaults in places like bathrooms or school locker rooms, and they often point to one case. It's from Loudoun County, Virginia, where state officials say a teenage boy assaulted 2 girls in the girls' locker room in 2 separate schools after he was wearing a skirt to class and seemed to be pretending he was transgender, and then he was allowed into the girls' locker room as a trans girl. A comprehensive state report actually found the teenager had prearranged at least one of those encounters before it became an assault. Teachers had already noticed he'd had behavioral problems before he started wearing a skirt. His own grandmother called him a sociopath on the record. And after the first assault, he was just sent to a second school where he then did it again. So in reality, the district didn't have a problem with the wrong people in the wrong locker rooms based on the wrong genders as much as just the wrong people in the wrong locker rooms because they were committing sexual assault, which is what the investigation found. And that same school district just suspended a group of teenage boys who videotaped themselves bullying a trans boy in the boys' locker room. So the crime that time was actually the other way around, which is the way it normally is. Trans people are 4 times more likely to be the victims of crimes compared to cis people, according to the Williams Institute. And 28% of trans kids, according to the Trevor Project, said they were victims of threats of violence or actual violence in schools last year. So bringing this back to the DOJ subpoenas at the beginning of this episode, it's the government in those subpoenas targeting a group of kids who are a vanishingly small part of the population, are more likely to be in danger if they don't get access to the care the DOJ is now going after, and are more likely to be in need of a Department of Justice who is looking out for them instead of attacking the things that are keeping them safe. But I also said that this issue isn't just about trans kids, it's about all of us, because what these subpoenas are setting up is the ability for the government to start databases, to start collecting information they wouldn't normally have on groups of people that they want to target. And I know it sounds like I'm wearing a tinfoil hat, and trust me, it feels a little bit like I'm doing that, but we do already know that Health and Human Services and this administration are looking at targeting certain kinds of health classes of people. The Secretary of HHS, Robert F. Kennedy Jr., has talked about starting outdoor work camps for people with certain kinds of mental illnesses like anxiety, ADHD, or depression, or wanting to start a database of people with autism. None of that based in any kind of real medical science. And what the DOJ is doing here is arbitrarily saying that gender-affirming care, even when following international best practices, is a crime. They're just deciding that. And the question then is what's to stop them, if they're just deciding, from making things like saying childhood vaccines, which RFK Jr. and the Make America Healthy Again movement think are poisoning kids, are also illegal, or demanding the addresses of people on depression medication or who have substance abuse issues or anything for that matter, because they're just making up what is illegal medicine based on political drivers, not scientific ones. And in the end here, even if none of it gets that far, even if it just stays on gender-affirming care and trans kids, we have hard evidence that this is going to harm kids. It will do the exact opposite of what the administration says it wants to do. And a world with more dead kids does, in fact, affect all of us. And we shouldn't want it to be that way because it doesn't have to be. Okay, that is it for today's episode. Please rate and review the show on whatever podcast app you're listening to it on. Like, subscribe, hit the bell for notifications on YouTube, and leave a comment if you're a watcher there. Sign up for the Make It Make Sense Substack. And as always, share the show on social media. It's Mims Newspod. That's MIMS Newspod. All one word on every platform. I am at Granthermes on Twitter and Bluesky, and at Granthermes TV on everything else. Thank you so much for listening today. I'm Granthermes, and I'll talk to you tomorrow.